you right now, I'd be in a pretty sticky situation. Luckily, I had laser eye surgery a week ago, so my eyes are actually completely fine. But I've had a lot of questions about why I did it, what the process was, did it hurt, etc. So I'm going to answer those right now.
Well, I won't be needing these anymore. Contact lenses? Nope. No more of those.
So the first question that I've had by almost everybody is, why have I actually gone and done it? Why have I gone and got laser eye surgery? Were my glasses or contact lenses not good enough? Well, no, of course they were. They allowed me to see. But they were a bit of a pain in all aspects. But more importantly, the way I see it is that it's essentially a disability if you can't see. Think about it this way: if I lost my glasses and if I didn't have access to my contact lenses, then I'd be pretty housebound. I wouldn't be able to go outside, I wouldn't be able to enjoy life, I wouldn't be able to see street signs or cars. You know, that would make life pretty hard and pretty dangerous. So that's why I see it as a little bit of a disability to not be able to see properly. And if you had a chance to change that, if you had a chance to cure that permanently, wouldn't you take it? That's what I thought. But then the other thing that really pushed me to get laser eye surgery is that contact lenses weren't really working out for me too well in my particular sport. What do I mean by my particular sport? Well, let me show you. So yeah, in skydiving, you don't really want to have a situation where your contact lens dries up or falls out halfway through a jump. That would kind of ruin your day. So I thought, it's finally time to go and have my eyes lasered once and for all. The second question that I've been asked by a lot of people is, well, isn't it dangerous at all? Surely there's some sort of small chance that something can happen to your eyes, or something terrible can happen during the operation. Well, the fact is that laser eye surgery has been around since the 1980s. It's been refined over decades, and there have been over 60 million procedures worldwide. That's like more than the population of the UK. That's a lot of eye operations, and considering that most of those procedures are perfectly safe, the chance that anything happening is very, very, very small. Now, I'm not going to preach that it's, 100% perfectly safe, but then nothing is 100% perfectly safe. Crossing the road isn't 100% perfectly safe, but would you cross the road to cure yourself of something that's affecting you every single day of your life? Well, of course you would. It's a calculated risk, and it's actually the same thing that I'm doing in skydiving. Every time I jump, it's a calculated risk. I'm minimizing the risk of the skydive by what I do in the air. And it's the same thing here. It's a minimization of risk by various things of where I choose to have the operation, and making sure that the care is the best I can possibly get. I actually picked the place where I had my laser eye surgery done, the London Vision Clinic, and the guy who actually performed the surgery, a chap called Professor Dan Reinstein, because of the fact that they are, and he is, a leading pioneer in the realm of vision correction. And this goes back to the risk minimization part of things. I wanted to pick the best because, I mean, it is my eyes, obviously. So to minimize the risk, I went with the best. And whilst my eyes, luckily, they turned out to be in the kind of normal spectrum for laser eye correction, these guys actually deal with patients who've been rejected for laser eye surgery before, or who've got any other kind of complications from this. So they're able to treat such a huge range of patients, which actually just gives them the expertise that made me choose them. They even helped build the actual laser machine with Carl Zeiss that actually did my procedure.